In today's fast-paced world, where stress and tension have become commonplace, many individuals find themselves grappling with muscle tension. Whether it's due to long hours at a desk, physical exertion, or emotional stress, muscle tension can be a persistent issue that affects overall well-being. In the quest for relief, one holistic and time-tested approach stands out: massage therapy. This article delves into the intricacies of massage therapy, exploring its various techniques and the profound benefits it offers in alleviating muscle tension. Understanding muscle tension. Before delving into the therapeutic benefits of massage, it's crucial to understand what muscle tension entails. Muscle tension refers to the state of tightness or stiffness in muscles, often resulting from physical strain, poor posture, emotional stress, or injury. Persistent muscle tension can lead to discomfort, reduced flexibility, and even chronic pain. Addressing muscle tension is essential not only for physical comfort but also for promoting overall mental and emotional well-being. Massage therapy techniques. Massage therapy encompasses a wide array of techniques, each designed to target specific issues and promote relaxation. Some of the most common massage techniques effective in addressing muscle tension include Swedish massage. This gentle and soothing technique involves long, gliding strokes, kneading, and circular movements. It promotes relaxation and helps release tension in superficial muscles. Deep tissue massage. Targeting deeper layers of muscles and connective tissue, deep tissue massage employs firm pressure and slow strokes to alleviate chronic muscle tension and break down adhesions. Deep tissue massage offers both physical and psychological benefits. It can relieve muscle pain and stiffness and provide stress-relieving relaxation for the body and mind. Deep tissue massage is a massage technique that's mainly used to treat musculoskeletal issues, such as strains and sports injuries. It involves applying sustained pressure using slow, deep strokes to target the inner layers of your muscles and connective tissues. This helps to break up scar tissue that forms following an injury and reduce tension in muscle and tissue. It may also promote faster healing by increasing blood flow and reducing inflammation. Read on to learn more about deep tissue massage, including how it stacks up against Swedish massage and what to expect during a session. Deep tissue massage offers both physical and psychological benefits. Unlike other massage techniques that focus on relaxation, deep tissue massage helps to treat muscle pain and improve stiffness. But it can still help to you unwind mentally, too. A 2014 study involving 59 participants found that deep tissue massage helped to reduce pain in people with chronic low back. The authors likened its effects to those of non-steroidal anti-inflammatory drugs, such as ibuprofen, Advil. People have also reported that deep tissue massage helps with sports injuries, fibromyalgia, plantar fasciitis, high blood pressure, sciatica, tennis elbow. Trigger point therapy, focused on specific trigger points in muscles. This technique involves applying pressure to alleviate pain and release tension. It's particularly effective for addressing knots or tight spots. Shiatsu, originating from Japanese traditional medicine, Shiatsu involves applying pressure to specific points along the body's meridians to release tension and restore energy flow. Thigh massage, incorporating stretching and compression techniques. Thigh massage aims to improve flexibility, release tension, and promote overall well-being. Benefits of massage therapy for muscle tension. Improved blood circulation. Massage therapy enhances blood flow to the muscles, promoting the delivery of oxygen and nutrients. This increased circulation helps relax tense muscles and facilitates the removal of waste products, reducing muscle soreness. Release of endorphins. Massage stimulates the release of endorphins, the body's natural painkillers and mood elevators. This not only provides pain relief but also contributes to an overall sense of well-being and relaxation. Reduction of muscle tension and knots. The various massage techniques work to break down muscle knots and release tension, allowing muscles to return to their natural, relaxed state. Enhanced flexibility and range of motion. Regular massage can improve flexibility by lengthening and stretching muscles, thereby increasing the range of motion. This is particularly beneficial for those experiencing stiffness or limited mobility. Stress reduction. Massage therapy induces a state of relaxation, reducing the levels of stress hormones such as cortisol. This, in turn, helps alleviate mental and emotional stress, contributing to an improved sense of well-being. Improved sleep quality. Many individuals with muscle tension also struggle with sleep disturbances. Massage therapy has been shown to promote better sleep by reducing tension and promoting relaxation. Boosted immune function. The stress-reducing effects of massage therapy contribute to a strengthened immune system. By reducing stress, the body is better equipped to fend off illnesses and maintain overall health. Alleviation of chronic pain. For individuals dealing with chronic pain conditions, such as fibromyalgia or lower back pain, massage therapy can provide relief by reducing muscle tension and promoting a sense of relaxation. Massage therapy stands as a versatile and effective approach for addressing muscle tension, offering a multitude of physical, mental, and emotional benefits. Whether seeking relaxation or dealing with chronic pain, individuals can find relief through the healing touch of massage. As part of a holistic approach to wellness, regular massage sessions can contribute to an improved quality of life, fostering balance and harmony in both body and mind. As always, individuals should consult with healthcare professionals to determine the most suitable massage therapy approach for their specific needs and conditions.